Welcome to our morning show on WRCO. Today we are pleased to recognize pharmacy professionals. The Richland Hospital is recognizing Pharmacy Week this week. And we have in the studio Dave Kepler and Maddie Oe, and they are going to be talking about all the things that they do from their job and their standpoint. So we say, good morning, Dave. I don't know if we've had you on the air before here. Good to have you.
It's been, I have been on the air before, but it was quite a while ago.
Long time ago.
Yes.
Okay. Looking at your job, it certainly has changed through the years, hasn't it?
I grew up in the area, went to pharmacy school in Madison and graduated in 2005. Have experience in retail pharmacy. And hospital pharmacy, have worked a few different places over the years, gained good experience. I'm currently the director of pharmacy at the Richland Hospital. Been a great place to work, and lots of different and interesting things over the years.
And Maddie, what about you? Can you tell us a little bit about yourself?
Sure. So I'm from the Madison area, but I do have some extended family out here, so I've got some ties to this region. I went to UW-Madison for pharmacy school, as well as my undergrad, and then I headed out to Seattle for a year because I had matched with Seattle Children's residency program, so got a little bit of hospital experience out there, and then had came back within the last year and been practicing in the community and found that that's kind of my niche, and that's what I really love to do.
When you were growing up, is that what you could see yourself doing, being in the healthcare field?
Actually, I've got a weird story. I was 12 or 13 when I decided I wanted to be a pharmacist. We actually did a school project for a career unit. So I picked pharmacy at age 12, and I decided to stick with it.
I'm going to say you're about 1% of kids that probably
Yes.
back then decided and then they became that profession. So, yeah,
Yes.
that's very interesting. Out of curiosity, how long does it take to get through pharmacy school these days?
Sure. So it does require a doctorate, which is different from years past. Before it was a bachelor's degree, but now you require a bachelor's degree. So I have a bachelor's of science in pharmaceutical sciences, and then you go to 4 years of graduate school after that. So it's typically an 8-year track, and then you get your doctorate of pharmacy. And then after that, if you want to go further, there are options for residency.
That is incredible. I would think pharmacists have to have good memories. Dave, is that the case? Do you think you've got a good memory?
For some things, yeah, lots of certainly in school, a lot of memorization
Right.
on different things. But yeah, we've got lots of different resources that we can rely on. But yeah, our brain's a primary thing that we use. But yeah, memory's not quite what it used to be.
How many members of the pharmacy team are there at the Richland Hospital?
We have 15 employees at the Richland Hospital, so not all are pharmacists. We've got, I'm probably going to miss a few here, I think 7 pharmacists on staff, and then 8, I take that back, 8 pharmacists and 7 technicians, I believe. So the pharmacy technician training is a little different than a pharmacist. Pharmacy technicians, their role in the pharmacy is to assist patients, assist the pharmacist, help with more technical functions and preparing medication. So they're critical to the operation of the pharmacy, whether it's in a community retail setting or in a hospital setting. They're in all of those locations and fundamental to what we do. Their training can vary. Many are trained on the job, but there are options for folks to go and get trained at a technical school and to learn more about the trade and the profession. There's certification options for pharmacy technicians, so that's often done, after somebody's worked in a pharmacy for a while, just to kind of elevate their practice, learn more about their field, and get a certification to kind of demonstrate that competence. So, as I said, technicians are crucial to what the pharmacies do day to day.
They carry out lots of times the prescriptions then and things like that.
Yeah. I mean, from inputting, in a retail setting, processing the prescriptions, and typing up a label on the prescription, selecting the medication, and counting it out, making sure that we've got the right thing in the right bottle, and everybody's working together to make sure those things happen. But really, we couldn't do it in the pharmacy without that dedicated role.
Could you talk about a typical day, Manny, when you go to work, or is there a typical day?
Sure. I can talk about what a typical day in the community setting looks like, because that's what I've been primarily doing the last year. As a pharmacist, I'm checking medications for one thing. So like we said, our techs are super important to our jobs. I couldn't do it without them. They're often getting things prepared and ready, but then it shows up on my desk to do the final check. When I'm looking at it, I'm making sure that it is the correct drug in the correct dose, the correct patient, and second identifiers to make sure there are no mix-ups. I'm then checking the drug to make sure it is appropriate for whatever indication or usage it has. I'm looking at possible side effects that I might want to inform the patient of. I look at the patient's medication profile to see if there are any interactions I need to make them aware of. And I just do an overall quality check of the product. Beyond that, though, I'm often on the phone with doctors and providers. We have a lot of collaborative decision making when it comes to questions about what medication the patient could be taking or what is on their drug formulary plan. So working with insurance offices, working with the provider's offices, kind of being the middleman of trying to get the patient the correct drug at an affordable price, or the best we can do. Then I also give a lot of vaccines. That's something in the future we're going to hopefully be doing. Also, it's just projects here and there, trying to help the community with medications in blister packs or little pill boxes we set up, a lot of education. It can really vary. There's a lot of jobs that I do on a day-to-day.
Yeah, those pill boxes are really important, because not only for, I guess we first of all think about it for the elderly, but even for us, sometimes you're like, did I take that today? I can't remember. So those are perfect, aren't they?
They are. And even as a pharmacist, sometimes I'm like, man, I am not the greatest patient, because I can falter myself missing a dose. So those pill boxes can be really helpful for a lot of folks of just keeping yourself accountable.
We've all seen the ads on TV for the drugs on TV, and all the side effects there. So Dave, you guys have to be aware all the time, I'm guessing, of possible side effects or interactions with other drugs too, don't you?
For sure, yeah. That's key. As Maddie explained, a key part of our job is assessing interactions and make sure we got the right drug for the right indication and the right use. On a retail setting where you're getting your prescription filled and you're getting a bottle of pills or in a blister pack, that sort of thing. But then on the hospital side, kind of behind the scenes, something that people don't have a great understanding of that. 2/3 of pharmacists work in a retail or a community setting. So that leaves 33% of pharmacists that do other things. And of that, that's broken down into maybe hospital-based practice, pharmacists working in research or academia or industry, pharmacists working in a clinic setting, like in a physician clinic, providing assistance to patients and providers alike to manage sort of focused disease states, often hypertension or heart failure. But for us at the hospital, we stay busy, managing medication use for our inpatients, patients that are coming in for surgery, medications that are used throughout the clinics and the rural clinics as well. And then the infusion center, a lot of medication use in the infusion center, and chemotherapy administration. So pharmacy is involved in all of that, looking at appropriate dosing and interactions and side effects and all of that. So additionally, on the hospital side, one of the things that we do is try to gathering information about what patients are using for medications at home. So we'll do a focused interview for patients to assess the medications that they're taking. Patients are seeing a lot of different providers sometimes and getting prescriptions from lots of different providers. And so making sure that we've got all of that documented correctly and accurately. Medications get added, medications get stopped. Patients maybe are taking medications differently because of side effects or a variety of things. So, we'll do that sort of best effort medication history and provide that to the physicians, working with the patient so that we've got a record of, kind of where to start from, and then we can make changes from there. And then, of course, kind of on the retail side, we're doing a lot of patient education too, to try and teach patients how to best use their medications, teach about side effects, things to watch out for.
During the pandemic, you really got an education, didn't you? Because I think things were changing almost weekly, weren't they, in terms of what was working and what you should do?
Yeah, for sure. I think that went on for COVID went on for a long time, and there was a period in time where we didn't have a lot of information to go on, and there was a lot of information sharing amongst professionals, amongst pharmacists from different facilities, and then amongst professionals at the Richland Hospital and other facilities as well. I think highlighting just all the great pharmacists in our community. We're blessed to have really great pharmacists, really great pharmacy services in our community. I think everybody worked closely together, during that period.
It was a learning experience, wasn't it?
For sure,
for everybody. Absolutely. It's interesting, Maddie, as you look at all of us, like all of our bodies are different. Like some people react differently to things. Maybe you have to be aware of allergies and all kinds of things, don't you?
Sure. Yeah, I know there are a lot of patients that can get frustrated with a medication not working to the level that they expected. So one of the jobs that I do is really trying to educate and talk with the doctor to figure out other options, because like you said, everybody's body is a bit different. Everybody's metabolism, their drug metabolism is a bit different, and there are unknown reasons why some folks respond better to one medication than the other. So that is a big part of my job, is advocating for my patients when something isn't working as well as they had hoped, and helping them have that conversation with their doctor and try to mitigate the adverse effects or whatever's going on and find a solution.
But you have to be aware all the time because, as Dave mentioned, maybe different prescriptions are coming in from different providers or whatever. But I'm guessing you get red flags now and then, like, wait a minute, this isn't going to work.
Sure. Yes. No. We have excellent computer systems that flag things for us and draw attention to it. The issue, though, that I find is sometimes when patients fill medications at a variety of different stores in different places, then they don't have a comprehensive list at one place. So then those computer flags might not show up because we don't have their entire med list if things are getting filled here and there and everywhere. So something I always encourage patients is to kind of stick with a pharmacy that they're comfortable with and have their entire list filled there so the pharmacist can really keep a close eye on everything.
Indeed. If you're buying something online, you're not going to be aware of that, obviously.
Right. Or the over-the-counters, too. Over-the-counters and supplements. I usually like to go out into the aisle when I see someone perusing just to ask questions and offer my guidance and help, because there are supplements that have drug interactions that the public is not aware of. So that is always a good question to bring up, that OTC or supplement up to the counter. We're always happy to help and happy to answer questions. I would encourage that as well.
Dave, for patients in the hospital, lots of times you go right to the room, don't you, and kind of explain things to them, the patients?
Yeah, we are for sure involved in that medication history and information gathering, and then throughout a patient's stay. Throughout a patient's stay, we're in checking on how maybe a current therapy is working with a patient, and then often at discharge, helping determine that plan for when the patient goes home and helping them be successful in that phase.
Fascinating stuff. We'll keep picking your brains after this time out here. The morning show from WRCO talking about the pharmacy at the Richland Hospital and the pharmacy professionals as we honor them during this week. On our morning show today from WRCO, we are here with a couple of the pharmacy professionals from the Richland Hospital. Dave Kepler and Maddie Oe are talking about some things that they do in their everyday work and career. Maddie, one of the things we wanted to talk about was insurance. That's probably the biggie, when we're talking about prescriptions and affordability and all that, isn't it?
Oh, yes. Very hot topic. It is a very tricky one to navigate, but luckily pharmacists can help patients out with that. I guess I could kind of give just a broad overview of what we do and what that looks like. Insurance companies, they have something called a formulary, which is basically a list of drugs, and some are preferred and some are not preferred. When a doctor prescribes a medication, they might not have the specific patient's formulary memorized. So then it's kind of our job to help the patient mitigate the situation. So let's say it is a medication that is not preferred, often would have a really crazy high expense. So something we can do is facilitate a prior authorization, which is just a big stack of paperwork between us and the doctor's office to try to get something covered. Another option, if something has an expensive copay, for example, it is a brand name medication and there are generics available, or there's an alternative that does a comparable job in the body but maybe has a little lesser costs, we can have those conversations with the patient and the provider and try to find something that works. Definitely a hot topic, definitely something that we are not the complete experts, but we do our absolute best to try to get patients the best deals we can.
So the generic or the brand name, I guess, so to speak, is there any difference?
Oh, that's a good question. So often it's the exact same active ingredient. So the drug is an active chemical, but how something is branded can be different. Let's just take a over-the-counter of Tylenol. We know Tylenol, that is a brand name, but the active ingredient in Tylenol is acetaminophen. And you can buy acetaminophen just as a generic option, which has the same active ingredient. So they are interchangeable at that point.
I see. Sometimes you guys probably take the brunt of somebody like what? The cost. I know you don't intend that, but you're really trying to search for them to try to find the best deal, and that's probably hard to do sometimes, isn't it?
Yeah, I get yelled at a bit as a pharmacist, and I understand that folks are so frustrated, and what the core of that frustration is just wanting them to be well and be healthy, and so I do my best to help, but yes, I do not have control myself over what the insurance covers, which I think is a misconception that the pharmacist is in charge. I'm not in charge of what the insurance will cover and what it will not, but I can kind of act as the advocate or the middleman and help make the situation the best we can.
Indeed. And then certainly, again, trying to find the right thing for the right person, that maybe this isn't working as well. You're trying to find maybe something better that will work with them.
Yes, and that is always a group decision between the patient, the pharmacist, the doctor. It's what we call collaborative care. It's all of us working together to figure out our best options.
We're getting into cold season. Is there something over the counter that actually will ward off a cold? Because I know there are several, and I myself have been like, oh, I've got a little sniffle. I better take. Does that actually work, or is that more of a placebo, Dave?
That's a good question. I can't think of anything that would be successful at warding off the cold other than washing your hands. Trying to avoid transmitting. That's going to be much more effective to avoid transmitting those illnesses. Viral. Those commonly viral illnesses that are circulating this time of year.
Vitamins, though, right? Vitamins probably is a good idea.
I think vitamin is certainly generally not harmful. They've done studies to see if like zinc, for one thing, as a supplement, can that prevent colds. I think the research is mixed on if it can or not. So I don't think there's any clear fix for that.
We wanted to talk about antibiotics a little bit as well here as we get into the fall season.
Yeah. One thing that pharmacists are pretty involved in on a hospital side or a retail side, kind of in all settings, just because that all antibiotics are medications, is the concept of antibiotic stewardship and managing that resource effectively. So, differently from some medications, antibiotic use and overuse can predispose or cause concerns about antibiotic resistance amongst bacteria. So, there's a focus to try to use antibiotics only when they're going to be beneficial. For instance, using an antibiotic for a viral infection. There's some viral infections where we use antivirals, but an antibiotic like amoxicillin or penicillin is just not going to have an impact on the common cold. For a simple self-limited viral illness. I think in all settings, pharmacists are looking at antibiotics as well as other medications, just to be sure that it's being used for an appropriate indication. Trying to manage side effects. Antibiotics have side effects as well. And so, again, if just to try to use that appropriately, use that for the correct duration of therapy. Always advising patients to complete their course of antibiotics rather than to take it for a couple of days and then when they're feeling better, not use the rest of it. So that can predispose to antibiotic resistance too. So especially if you're taking it inconsistently, taking it for a day here and skipping a day and then taking it again.
And we have the drug take-back days, too, a couple of times in the community a year. Those are important, too, for unused medications.
Yeah, for sure. So I think I believe that's this weekend at the Sheriff's Department is doing a drug take-back day. So, yeah, this weekend an opportunity to go through and gather up medications that you're no longer using and dispose of them safely and appropriately, and avoid them from going into the landfill and getting into our water supply.
And Maddie, right now, vaccinations, flu shots are available, I'm guessing?
Not currently. I believe our clinic is providing those, not in the pharmacy setting.
Not in the pharmacy.
Quite yet.
Okay.
Yeah, so the hospital has flu and COVID vaccine clinics now that you can make an appointment for, so those are ongoing now. As many know, I'm sure many know, the hospital's in the process of opening up our own retail pharmacy. We don't have a date for that yet, but we anticipate being able to offer vaccines in that when that's open. We're hopeful that we'll have our retail pharmacy open by the end of the year. So more info to come on that, but kind of watch our website and Facebook for more information on that. Hopefully by the end of the year we'll be open and operating that.
And Maddie, you'll be a big part of that, won't you?
Yes.
Yeah,
So,
and Maddie will be so Maddie's joined our team, and she's going to be our pharmacist in that pharmacy. So
I'm really excited to be connecting with the community out here. It'll be a lot of work and a lot of planning to get it up and running, but I feel like I've got a good team at the hospital. I've been working closely with Dave, so really happy to serve this community soon.
You'll be the face of the franchise then.
Yes.
I'm guessing too, now I know it's into the sign up for Medicare, Medicaid. I'm guessing you have to be real well versed in some of those laws and things and benefits too, don't you?
Yeah, so open enrollment is usually a hot topic over in the community pharmacy, and we cannot necessarily tell you what plan to choose. However, we can guide you to different resources where you can compare plans. So one place is the Medicare.gov is actually an online site where you can put in the drugs you take and do a plan comparison. So helping folks get to those resources so they're well educated to make those decisions is something that we often do and are happy to support in that area.
Mm-hmm. What benefits some might be different for another person then too, right?
Yep, it all depends on your family, your medications, and what's right for you. So it's not a one-size-fits-all decision, absolutely not. So everyone kind of needs to do their own research, but we love to assist that process.
Youth apprenticeship. I know we've talked to other members of the Richland Hospital staff. I know they have the club scrub and all of those things going on. Do you have a youth apprenticeship available in the pharmacy, Dave?
Yeah, we do. We've just developed that youth apprenticeship program. There's a little bit of history to this, but some laws changed, and pharmacy technicians as a profession have to be registered with the state in the state of Wisconsin, and there's some requirements for that registration. It's not a difficult process, but there's just a process where people have to be registered to work in a pharmacy as a pharmacy technician. That's impacted, folks, or especially high school students' ability to work in a pharmacy. But this youth apprenticeship program is an option for that. So the program, very similar to other professions, nursing and whatnot. This youth apprenticeship would be for a high school student to explore career options and to spend time working in a pharmacy to further explore that interest. So they'll be in a defined sort of curriculum in the school setting, and then apart from that, they'll have time that they work in a pharmacy. So to complete a youth apprenticeship, I believe it's 450 hours, I think, and so we've recently developed that program at the Richland Hospital and are offering that right now. So if you have, and that, I guess to back up, this is a great option for students, high school students that are interested in pharmacy in general, to learn more about it. And that could be whether they're interested in the pharmacy technician profession or pursuing being a pharmacist. So great opportunities to kind of explore the fields through youth apprenticeship while you're in high school. So if that's something you're interested in, I think the local guidance counselors at the schools can assist, and we'd be happy to discuss it at the hospital as well. So
I'm guessing when Dave Kepler was in school at Richland Center, you would have probably jumped at a chance like that, wouldn't you?
You know, I didn't decide pharmacy was something I was pursuing until more into college. But yeah, that would have been. It's a nice program in that it gives some structure to some of that exploration, and so it's a really neat opportunity in that sense. So I think the other neat thing about pharmacy is that you once you're in that, you get exposure in the hospital. You're exposed to a lot of different other professions. So you're just exploring. You're kind of seeing what things are like. If it's interesting to you, there's a lot we can show you in pharmacy. So.
What would some of the duties typically be for a youth apprentice?
So a youth apprentice would start out, depending on the setting. I think in a retail setting, they'd be collecting money at the register and finding the prescription and helping coordinate things with the pharmacy technicians and the pharmacist, more as a pharmacy clerk or pharmacy assistant. In a hospital setting, it would be more. We haven't had a youth apprentice yet, but we're working on developing that. We're excited to offer that, and we'll have our first youth apprentice starting soon. I think that our duties are going to be selecting the right medications for restocking in different areas, and we use a lot of technology for that. So there's different systems that people would be trained in, and learning, lots of opportunity to learn about the medications. To learn about the medications, you learn physiology in the body and normal and abnormal physiology. Just lots of different opportunities there.
Another avenue that I guess we haven't discussed, but you help in terms of chemotherapy at the hospital as well, don't you?
Yeah, we prepare kind of behind the scenes often, but we're preparing all the chemotherapy for the Kramer Center, infusions in the Kramer Center, and other treatments that are provided in the Kramer Center as well. So we work closely with those UW Health physicians and the Kramer Center staff to prepare those chemotherapy regimens, which can be quite complex at times, to provide that care, locally to our patients to avoid the travel to Madison when they're ill.
Sometimes you have samples of drugs too, right? That the doctors can prescribe, or do they do that anymore? Where they might give out a sample just to try it and then see how it works?
That samples are more often in a physician clinic setting. Mm-hmm. And then on the pharmacy side, sometimes there'll be, from an affordability standpoint, there's not insurance, but copay cards. Often manufacturers might offer that to help with affordability, or patient assistance programs. So pharmacies, as a rule, don't get involved in samples per se. There's actually laws prohibiting that. But on a clinic side, there's samples are distributed usually through the clinics. Yeah.
Maddie, I want to ask you, because you're a young person in this profession, but how do you see the future of pharmacy and pharmacists here down the road?
Sure. Thank you for that question, because this is something I do love to talk about. So I think in the future, pharmacists will really be able to practice at the top of their scope, which what that may look like is something called collaborative practice agreements. That is a agreement or a protocol that's developed between a physician and a pharmacist that delegates some of the doctor's duties to manage a certain disease state to the pharmacist. For example, we could just talk about blood pressure. So a doctor or a physician can make a diagnosis of hypertension or high blood pressure. A pharmacist cannot diagnose, but a doctor can. But from there, they can kind of delegate a pharmacist to help with the management of the blood pressure. So I see potentially in the future a patient being able to come to the pharmacy for an appointment to get their blood pressure measured and monitored, and then the pharmacist could then make dose adjustments with that collaborative practicing agreement in place. So there's definitely opportunity for pharmacists to expand their role, expand their scope, and kind of help the providers who are already stretched thin in the clinic, just so we can make care more accessible to everybody.
Do you see, I know telehealth has become a big thing over the past few years too. Do you see that in the pharmacy industry, maybe visits with people, through the teleconference too?
Possibly. I remember I had some rotations back in school where they had these kind of booths or consultation rooms in some of the pharmacies that just had technology set up and accessible. So there were patients that could come to their pharmacy to then log on to see their doctor virtually. That is something that's available in different places around the state. So I could see maybe it go in that direction as well, just because operating technology is definitely an issue for the older generation. So having a pharmacy or a location where you're able to get assistance in that, I think it's just another wonderful way pharmacists can make healthcare more accessible to the community.
Could you see like a conference room then where you meet with patients and things like that in the future as well?
That's a possibility too, or even kind of like a clinic room in the pharmacy. There's something called provider status, which is being worked on as legislator, where pharmacists could have appointments to do things like, it's called MTM, which is medication therapy management, or CMRs, which is comprehensive medication reviews, where they could actually sit down, hold an appointment with a patient to go through their med list and mitigate any issues. So there's that possibility as well. There's lots of options that could happen here in the future.
Anything that you wanted to say, Dave, about the future?
No, I think Maddie touched on a lot of key things that for the future of pharmacy and really the present day of pharmacy in a lot of places. So I think these things are out there and happening. So even on the hospital side, we're doing a lot of these collaborative or practice agreements currently. So we're assisting providers in dosing anticoagulants, warfarin specifically, for patients that are admitted to the hospital. Little different environment, of course. It's in the hospital in a little more controlled setting than kind of what Maddie's describing, but I think the concept's the same, where we have a protocol that the pharmacist is following, and it's sort of assisting the provider to take care of the patients, take the load off of a provider, and allow still excellent care for the patient.
What do you like most about your job, Dave, as director?
The variety, the opportunity to work with all sorts of members of the healthcare team. I sure enjoy working with the team I've got. We've got a great team of pharmacists and pharmacy technicians. Just try to do our very best to help take care of patients and optimize drug therapy and streamline care and make things safe.
And you don't want, preferably, you want people to be off the medication as fast as possible, if that's a possibility, right?
Yeah, for sure. I mean, just to avoid side effects where possible, but there's so many conditions that are really the current care is medical management, and medications are often necessary, but that kind of gets back to focusing on patient health and encouraging healthy living, good diet, exercise, weight loss, those sorts of things too. So pharmacists get involved in those things as well, in sort of clinic or retail settings. And just sort of impromptu when patients come and ask their pharmacist for advice. Those discussions happen not infrequently.
Maddie, we'll let you respond as well. What do you like most about your job?
Sure. So I love people. I love serving others. I love getting to make personal connections. And I love being a teacher and an educator. That's probably my favorite part of the job, is sitting down with folks and really giving them the education piece that they need.
Are you doing anything special at the hospital? Or are they doing anything special for you this week during Pharmacy Week? You haven't seen the cake yet.
No, that cake's on order.
Okay.
But I think just a lot of thank yous in the halls, and just shout outs to the team. So it's been fun. One of our team members, Caitlin Wolfgram, went down to the UW School of Pharmacy just for some outreach on Friday to kind of highlight highlight the opportunities for students coming out or just coming, growing in the profession, looking at their fourth year clinical rotations, before they graduate as a pharmacist, and trying to interest them into rural practice, and it's a great place to be. And so Caitlin went and represented us to kind of get the word out and let people know what we've got going on.
How many pharmacy schools are they? Are they common?
There's 3 in the state of Wisconsin. So there's UW-Madison, Concordia, and then Medical College of Wisconsin have pharmacy schools now.
Okay. And do they stay pretty busy? I mean, are students getting into that field quite regularly?
Yeah, I mean, I think that enrollment has fluctuated, and I think nationwide annual enrollment is around 10,000 students. So each year, about 10,000 students graduate. Kind of looking into the future, they're predicting that we need to replace current staff exiting the field. We need 14,000. So a substantial shortfall. So I think that it's a growing field. I think in the time that I've been in practice, I've seen the field grow and expand, and lots of additional opportunities. And certainly the growth of pharmacy. There's 2 more pharmacy schools than there were when I graduated. The Concordia and Medical College of Wisconsin didn't exist when I graduated. But I think that there's still ample demand out in the in industry, in the work setting. So it's a good field to go into.
I'm just amazed at what you have to know, though, and the responsibility. I think that's something that you really relish, though, Maddie.
Yeah, I take my job seriously. I think pharmacists are in a privileged position of being a trusted healthcare professional, a trusted member of the community. So it's something I definitely don't take lightly, and it's something that I am constantly learning and making sure that I'm up to date on everything so I can serve people well.
Trivia question for you. Who's the most famous pharmacist in the movies? The movie character is a pharmacist. Any idea?
I've never seen a pharmacist.
You've never seen a pharmacist in a movie? You're getting it.
Yeah, I've got it.
It's an oldie.
Yeah.
I don't got it.
It's a Wonderful Life.
It's a Wonderful Life, yeah.
Mr. Gower.
I didn't know his name.
There you go. So there is a famous pharmacist in a movie, at least one. So, well, thanks for all you do. We appreciate you guys very much. Thanks for coming in.
Thank you,
Phil.
You bet, and good luck to you. Dave Kepler and Maddie Oe joining us from the Richland Hospital. You can talk to them the next time you're by the Richland Hospital. Dave is director there of the pharmacy and the clinic.